But we begin by taking you back to March of last year. The nation rallied around medical professionals as they dealt with overwhelmed hospitals filled with COVID patients. Unfortunately, that fight continues, and now nurses in California are taking on yet another battle. More than 24,000 Kaiser Permanente health workers have voted to strike over working conditions and pay. Joining us now, Executive Vice President of the United Nurse Associations of California and Union of Healthcare Professionals and Registered Nurse, Charmaine Morales. Charmaine, thanks for being with us.
Yes, thank you for having us.
Well, your union released a report and mental health survey titled The True Cost of Being a Hero, Mental Health Strains in Nursing and Healthcare. What is your organization advocating for now, Charmaine? And what has it been like for your colleagues this past year?
So you hear from our members that are registered nurses and other healthcare professionals. You hear about it from others across the country, across the world. They're burnt out, they're stressed out, they need some help, and they're hoping that someone is listening. And as we've spoken to our members, that anxiety and that burnout, it has its limit, right? It's going to have its breaking point. And with our current bargaining, the proposals from the employer do not make any sense to us. It's not going to help. We need help with staffing. We need to be able to bring folks in. We need to retain qualified, skilled professionals. And we're so far apart right now. It's very concerning. And I can only imagine of how this, us having to take it this far, to taking it to a strike vote, that increased emotional trauma that it causes of why are we needing to do this? Why are we even needing to have to discuss this? And Kaiser Permanente put proposals out there that are ridiculous.
So let me ask you, because in your release, you said your organization has said that 96% of union members approved a strike. So what do you think? I know you're in negotiations, but do you think this is going to happen?
It's too early to tell. We're negotiating this week. There's bargaining happening right now. Each day will tell us something new. I don't believe in the coming weeks we would need to take it that far, but again, only time will tell. And I'm hoping Kaiser Permanente will do the right thing and continue bargaining with us and getting to a place of understanding that makes sense for our members.
So to you, what would that understanding be? What would satisfy the almost 100% of members that say they would strike?
So there's a few things. One, that tier wage proposal that the employer proposed, that's got to go. When you're at a time where you're trying to recruit, you have thousands of vacancies for healthcare jobs, and you're needing to offer bonuses, and you still are not able to bring in folks quick enough. How's a two-tier wage system going to help? How are you going to be able to say, okay, you'll bring you in down the road, but you're going to get paid less than everyone else? The raises that they're proposing, we live in California, cost of living is high, and the 1% wage proposal that they're offering doesn't keep up with the cost of inflation. And they have other contracts with other unions where folks are going to be getting a 3% wage increase. And we're seeing, wage increases higher up there with other healthcare organizations. So that 1% has got to go. And we want to talk about staffing. We had a subcommittee that was working on staffing and backfill, and work came to a halt for us as labor for the union, with healthcare workers, healthcare professionals at the table, came up with some great ideas, and we would like to further explore that, looking at short-term and long-term solutions that ultimately affect patients.
Well, and no doubt, we need our nurses, especially right now during this pandemic. People are still dying from this pandemic. And at the same time, we don't want our nurses to be overworked and exhausted and dealing with mental breakdowns and feeling like they're not getting paid enough. So, what would the impact be if it did come to a strike? What would the impact be on patient care and medical facilities overall? Because that is extremely troubling as well.
Yeah. So by federal law, we are required to give a 10-day notice if we're going to call for a strike. The employer, they're given that 10-day notice to give them time to work on ensuring that patients will continue to receive care. We've been negotiating with this employer since April. They've known that we're so far apart, and they've known about our strike authorization votes as well as other unions. So they're getting more than the 10-day notice to prepare. Patients will still get the care that they need. Ultimately, though, falls in Kaiser's court if they want that care to be provided by our members, by our union members that are committed and have been committed to the patients, to the community. They've been committed to Kaiser Permanente through the pandemic before, and we'd like them to still be there providing care to those patients.
Charmaine Morales of the United Nurse Associations of California and also the Union of Healthcare Professionals. Appreciate your time today. We'll follow.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.